Welcome to our Wednesday night, 7 p.m. Central Standard Time training call. We are talking about everything Medicare related, everything that you're going to run into in the field in Medicare. You're going to sit down with clients. You're going to see it. Maybe you're not selling it. You don't even know how to sell it. You don't know how to pitch it. What is it? What is Medicare in and of itself, right? Is it health insurance, right? What is it? Does it include dental? Does it not have dental? How do the different plans work? Do people pay for it? So there's all a lot of questions that people have, whether you're green or you're new to the industry or you're a veteran, right? And you've been in the game for a little while, there's always something that we all can learn from each other. So the purpose of these calls is not just to do boring educational stuff, right? But it's actually do some like real sales training. So that's the huge thing. Yeah, Gustavo's a savage too. Got to meet you yesterday, brother. It was really great seeing you. So absolutely. So that's a ton of questions that we're going to have. So let's start off with just going into, I know last week we did my processes on what I do, right, with agents or with a client when I'm in the home, right? My actual steps that I take in order to go through my sales process step by step. Here, this is what I get, right? This is how I start talking about it and all things along those lines. Okay. Then what I do is I show you kind of how I gather the information from the client and then how I go ahead and I'm able to pitch them on the different products. So let me just take my cell phone out just in case anyone decides to text me if there's something that you can't hear, maybe audio or something like that isn't good, whatever it might be. All right. So what we got here is I'm going to do a screen share with y'all. So let me go ahead and do that so you can see my screen. Screen one, boom. All right. So we got this monitor on up. So basically, let me X out of this. I want to just show you guys what I'm doing. So I'm just going to my website, finalexpensemastery.com. All that you do is you have this Medicare agent portal. Okay. So in here is going to teach you everything that you need to know about Medicare itself, right? The basics of it. So here we have portal training. Okay. And this is all this Final Expense Mastery on my website or Final Expense Services. Doesn't matter. I built both of them, right? So it's the same exact thing for both of them. Okay. So on here, we have all this different stuff for the portal training. We have Sunfire overview, right? How do you activate Sunfire? Well, you click this PDF, it opens up and it walks you through it step by step. Where do you go? Okay. So all that stuff that you need to know. In addition to that, where do you get Sunfire portal? You click that button, you go there, it's going to bring you right over to it. Well, I'll kind of walk you through this right now. Your enrollment Medicare, your enrollment center, you click that, your Medicare Sunfire, you click that, brings you right here to access the Sunfire tool. So you click that and it's going to open on the Sunfire tool on up, which is pretty cool. All right. So it's this one, but we're going to go back to that anyways. So now from the website, also, you can get medicare.gov. You can click the link or you could type in medicare.gov itself, whatever you want to do. It doesn't matter. It's going to bring you there. You click that, brings you right to it. Okay. So, and that's something else. So we have all the different carriers, the portals, stuff like that. So it'll kind of guide you there. So you get the gist of that one. Carrier contact form, right? This is crucial for you guys to have. This is all the phone numbers for the company. Their websites that you got to go to. You can write your agent number, your whatever your username is, your password, EAP username, EAP password, if that's different, right? So it's good to have this stuff. So it's good for you all to have this stuff in there because Lean is a separate app, so you can have it. You also have Sunfire in here, right? Sunfire says that there's no phone, so it's on email only, right? So there's no phone number associated with that. Okay, so just email only. This is where you email them if you have any issues. All right, so you got all that stuff. Just read the stuff and go through it. The next section over here is Intro to Medicare. All right, so where do you do AHIP? How do you get the AHIP discount? I'm glad you asked. You click this link and it's the AHIP discount link. Brings you to Agent Accelerator. You got that. AHIP $50 discount. Where do you get the discount? Right over here is where you get it. So you go ahead and see that on my website or finalexpenseservices.com. Either one doesn't matter. Then you go to the Medicare Parts and Program section. Okay. This section is going to teach you everything about Part C, which is Medicare Advantage, Part D, which is prescription drugs, Medicare supplements, hospital indemnity, LIS extra help, Medicare savings program, D-SNPs, C-SNPs, and a little presentation that's going to show you the difference between a med sup and hospital indemnity and kind of how you would pitch it. Right. So that's pretty cool. It's going to go ahead and also it's going to show you the election period cheat sheet from United Healthcare that they provide to us. That's going to go ahead and show you all the different reasons why you can sell this stuff outside of AEP, right? So it tells you right here, AEP, this is the election period, right? This is the election code, AEP, and it's going to tell you when does it last? 10/15 through 12/7. So during that time frame, you would use this. Then it tells you the next one, OEP. That's January 1 till March 31st. Okay. So if you look at it, that's about 2 months there, right? 7 weeks, about 2 months. Really starts about October 1st. You can compliantly start marketing it, but you can't submit any applications to October 15th. So you start talking about it, right? October 1st. So let's call that about 9 weeks total that you're going to start talking about this stuff. So it's about 2 months. Then you have another 3 months total, 3 more months that you could sell this stuff. So that's 5 months out of the year, just using these two, AEP and OEP, that you could sell it. The remaining 7 months, we have other stuff, OEP, new, right? SEP, SEP, all these, look at these. These are all the reasons why you can start selling outside for the other 7 months, right? 2 more pages of reasons why you can sell outside of there, or 2.5, right? So 2.5 pages of reasons why you can sell. Just read them, right? Educate yourself. It's good to know. Right here, ICEP, IEP. What does that stuff mean? Enrolling in Part B after delaying enrollment. Okay, so someone didn't have Part B, right? They only had Part A. What is Part B? Good question. Watch the videos. They're going to educate you. So you go ahead and you understand this stuff. And you got the Medicare worksheet, which is a form that you're going to be filling out in every single home, right? Last call that we did last week, we went over all this stuff and kind of what you're going to do. So this is usually what an agent and I were kind of looking at, figuring out the information and stuff like that and seeing, hey, what do you got, right? What does the client have? How can we go ahead and see if we can help them? If they got CHF or if they're a diabetic, well, we know that they're going to qualify for a chronic special needs plan. What's a chronic special needs plan? I'm glad that you asked. D-SNPs and C-SNPs, right? Watch that video. So that's in there for you. So let's go back to the website here. So you have all that. You got the Part D LIS chart, right? We want to know what income do these people qualify benefits wise? Well, good question. We got the chart here that shows you that the minimum or the maximum income that they can have is $1,549, right? And then anything beneath that, right? What they have here, these different numbers beneath that, they'll obviously qualify for some Medicaid, right? And it says meet state Medicaid. So state is Medicaid. Medicare is health care by the federal government. Medicaid is financial aid for your health care. That's the way that I always remember it myself, right? So you just have your important forms. This is crucial to have, and notability. If you don't know what notability is, get with your upline. They're going to teach you about it, kind of how to use it, stuff like that. Medicare savings program. This is going to tell you everything about Medicare savings program. It's right on the government website, medicare.gov right here. So I just got a link for it so you can read about it, right? You want to be the best in anything that you do in life, just in general. You want to be the absolute best at it, right? If you're cleaning dishes, you want to be the best person cleaning dishes. You want to be the most efficient person. Get that kitchen running as efficiently as possible, right? Whatever you're doing, it doesn't matter. Doesn't matter at all. The eligibility, how does someone qualify for Medicare savings program? Good question, right? Well, here's the income, right? $1,153. It's only the number on the right side of the slash that we're paying attention to. Okay. If single, if married, right? So that's it. Then they qualify and then they become this. If their income is here, 1,379 and then $1,851 if married, then they're this. And what happens if their income's in there? Well, it says it on the right-hand side. It pays their Part B monthly premium, $170.10. That's pretty cool. And if their income right here is $1,549, it also will pay that Part B premium of $170.10. So that's cool. So you just got to ask them, hey, how much is your income? Oh, perfect. Your income's beneath that. Do you care if I save you $170.10 a month? Great. Now let's talk about those other products that you were interested in that you told me you couldn't afford. Easy transition, really simple. So that's the website itself, and it got some training in there. All right, so you get to Sunfire, for example. You're over here, and we start looking at some cases, and we're figuring out exactly, what can we do to help someone out and put them in a good situation. So these are just cases that I'm looking at. I'm just seeing stuff like that. These are there's no personal information inside these ones. So it's just cases that I'm looking at on a daily basis, figuring out all this different stuff. So this is in zip code 77084. And what I was looking at in zip code 77084 is I was looking at all these different plans that this person has. So I click here, I go to the medications, I type in all the meds, right? Boom, type in all the meds, done. Next, I put in the doctor's name. Here we go. This is the doctor. See how it says PCP? It's your primary care physician. Nice. So I got all that information. Next, what I want to do is I'm looking at what does the client have? So I know that the client has WellCare. Okay, cool. Well, let's see what WellCare plan that they have. So I look at it, right? and I see that the client has this one right here. So they have this plan, right? So the doctor takes WellCare, just says it's not in a network for this one, but you call the doctor's office and confirm, right? WellCare, Texan Plus, Classic, no premium plan. So I asked the client, right? I'm like, how's your health? Like, pretty good. Okay. How often do you go to the specialist? He's like, I literally go to a specialist once a month. Dang, it's pretty expensive. So I take my pen, I write down on here. I literally start just like writing stuff down. 25. How much is the specialist? He goes to a specialist once per month. So he's going to a specialist 12 times a year. Cool. All right. So then I got to figure out how much the specialist cost. So this estimated annual cost here, and everyone knows this if you're looking at it, is based on these medications right here. Okay. So these medications that I put in is going to tell me how much it's going to cost based on these drugs, right? So let's uncheck WellCare and let's scroll down. Okay. So with this plan, it's $96. Okay. With this plan, it's 96. With this plan, it's $24 is the estimated annual cost, right? So let's go back. We'll click our WellCare again. Now, what I want to do, since I found out that the guy's pretty healthy, is I want to look at him and be like, hey, let's click that Part B give back box. Let's kind of let's see what we got going on here. The guy said he likes WellCare, doesn't want to leave WellCare. Perfect. Well, good news is, since you're healthy, and even though you go see a specialist multiple times a month, and you told me that you're paying that Part B premium of $170.10 because you don't qualify for the subsidy, I have a plan with WellCare, right, for that Part B give back of $95 per month, right? And his drug cost is gonna be nothing, right? You take that, do that math real quick. It's like $4 a month if he's even paying that, and we'll see if he is or he's not going to pay it. Okay, so we now know that this guy's paying $170.10 a month, right? Minus that $95. So the guy's going to save a lot of money, basically, to put it that way. So what I want to do is now I'm telling the guy, hey, your Social Security check's going to go up by $95 per month. Awesome. So $95 per month. That is huge. So just take your calculator out. 95 times 12. That's a total of $1,140 for the whole year. He was like, but why didn't WellCare tell me about this? I'm like, that's a great question. You know that booklet that you get every single year? It's about 300 pages thick. Did you read it? Because I know most people didn't read it. Most people don't. Did you? No. Okay, great. That's why. That's why we have a job. So Charles was calling me. We're talking. We're going over this stuff. Truman, and we were talking, going over the plans. And that's literally what I told people the day before when we were doing the training. Like, that's exactly what happens all the time. People, they just don't read the information that's sent to them, right? No one reads it, and no one reads it. So it's easy to overcome that objection. So we're looking at this over here. We got this Part B give back, $95. That's perfect. But remember, he's got a plan right now. So I got this give back. I want to compare it to what he's got, this WellCare Texan Plus plan. So I go ahead, I check that box. I hit compare. Okay. I go to the next thing over here. Let me see. I'm going to go ahead and show y'all. So the next thing that I want to do is I want to start looking at the differences of the plan. Now, I see over here, it's still zero premium, right? Excludes tier 1, tier 2. So his drug cost with this one, $0. Drug cost with this one is $48. All right, great. $48 tells you right here. This one's a tier 6, which, okay, 70 cents. Come on. $1, tier 2, tier 6, tier 1, tier 1, tier 2. This stuff's free. I mean, he's not paying anything. $4 per month. Okay. So he'll get it all through the mail anyway. So there's going to be no cost. So I go back to my compare. I look at it. I go back over here. I want to start looking at this, right? So let's read this first. This plan is designed for beneficiaries who seek to receive some or all of their Part B premium back in their Social Security check. So the insurance company is sending $95 per month back, okay, to the client, or they're paying $95 to the government. So therefore the client Social Security checks can go up by $95 a month. Cool. All right. So we're looking at it and we're saying, okay, well, we got drugs cheap, right? We have medications that, like we were talking about drugs, that means that's nothing. That's cheap. The guy's pretty healthy. He goes see a specialist, right? He's checking in. He told me 12 times a year. That's highly unusual, but he says his health is really good. Otherwise, you could tell by the drugs when we were looking at him, he's in pretty dang good health, right? So he asked, hey, how much is it when I go see a specialist? So a great question. Now You're paying $25. I confirm with him. Is $25 correct? He says, yes, that's correct. Okay, great. You go see a specialist 12 times. 12 times $25. That's $300 for the whole year. That sound about right? He says, yeah, that sounds about right. Okay, great. Now, with this new plan, the updated WellCare plan, that's going to increase your Social Security check $95 per month. I reinforce what I just said, right? I'm reiterating my point. I'm not just going to tell them what the cost is of the specialist without, hey, just so you know, once more time. I'm going to say it again. Boom, $95. This plan is going to increase your Social Security check by $95 per month. Okay. You go to specialist once a month, which is very weird. Probably won't do that your whole life. You think you're going to do that your whole life? Probably not. Right. So if the difference between $50 and $25 is $25, I just go ahead and I told him the math. Hey, with this new one, it's going to cost you $50 every single time you go. Right. So the difference between the two is 50 minus 25. Show them on my calculator, which is $25 increase when you go see the specialist. But you still don't pay anything when you go see your primary doctor. That's good news, right? So that's a $300 difference in price. So you're saving $1,140 for the year. Okay. $95 times 12. So your Social Security check's going to go up by that amount. If you continue to go see the doctor, the specialist, weird, 25 or 12 times in a year, you would pay an additional $300 with this plan. $1,140 minus $300, $840 what you're going to save. Okay. So you're still saving $70 per month. Does that make sense? And he's like, yep. Great. That's it, right? You go over all the stuff with him and he's done, right? It was really, really simple. It wasn't a complex sale at all. So the guy loved it. He's like, this is awesome. And he had his fiance there, right? Or girlfriend, whatever she is. And she had a different plan. Okay. She had this pretty good plan, which is the Humana Gold Plus plan. All right. And in addition to having the Humana Gold Plus plan, she was looking to do the same thing. All right. She wanted to do the same thing. So I had to look to see, right, if there's the give back plan that her doctor took, right? Which there happened to be. There happens to be a Cigna plan that is a give back of $100 in this area, right? Same area. I didn't change, nothing different. So I'm like, boom. Okay. Does her doctor take it? Find out her doctor takes Cigna. Great. Now all I'm doing is I'm just looking at it, compare. I'm like, how often do you go to a specialist? She's like, this is how frequently I go. Okay. Well, this math is starting to make a lot of sense. 4.5 out of 5-star plan. This one's a 4.5 out of 5-star plan, right? Go through all this stuff with her. Your ambulance cost is lower, right? With the other guy, his cost on the emergency room was lower too by $30. So if you ever had to do that, it's got dental in it. So it's still covering some dental. Okay. It's going to have doctor office visits is $0. Specialist goes up $25, just like in the other scenario. But this lady's saving $1,200. So the reason why I wasn't putting that guy with WellCare or moving him from WellCare is because he said he loved WellCare. So, okay, is there anything that, since you haven't made a change in a long time, right? And he said he's been in Medicare since 2001. Is there anything else that I can do, right, with that same company to help benefit him? Right. So we go over and he's like, yeah, I want to do that. Like, that makes sense to me. Okay, great. So for her, she's saving $1,200 in the year. She's saving an extra $5 per month. So she's saving $60 more than him in a year, $1,200, and she still gets a great, reliable company. So that is just amazing. So they were both thrilled. So in that house, he saved them about $200 a month, close to $2,000 a year, right? $60 off for $2,000 a year, $1,940 a year, one house. His first 2 apps he's ever done, Medicare, first 2 apps ever. So it's like, okay, well, I'm not going to run into that all the time, am I? I don't know. You might, probably not too frequently, but those plans are designed exactly for those exact scenarios. So you may run into it. Yeah, Mike. Yeah, of course, the max amount of pocket's different. So you're probably going to run into that, right? So that's going to be the difference there. Okay. And Mike, to answer your question, says Max, he wrote in the chat, maximum out of pocket is different, right? That has no bearing on it for people that are healthy. That's why I'm asking them, are you healthy? Are you in good health? Good. You stay in good health. You're saving money, saving $100 per month. right? That's it. So it's designed for people that are healthy. If someone's sick and they're not as healthy, am I going to put them in a plan that is way more expensive in cost? No. So I explain the differences to them and they say, hey, yeah, I want to do that. That sounds great. Okay, cool. Same company, same doctors, medications, all that stuff stays the same. But let me show you in black and white. So I show them right here in Sunfire. So I did that. That was one case. That was one scenario that we ran into today. We got a couple different ones that we were looking at as well. No, this one's not a good example. Let's see. This one. Oh, here's a good example. Here we go. View quote. So let's go ahead and let's look at this one. So this is in a different city, 63136. Okay. So this specific client over here, we were looking at, this one was a Medicare supplement plan. Okay. So this client had a plan F. This was last week when we were in St. Louis. So this client had a plan F, and her plan she had right over here was a United Healthcare plan F. She's paying $331 per month. That's a tremendous amount of money, right? With United Healthcare, what is going on with plan Fs, guys? What is a plan F? So plan F is a Medicare supplement plan that pays the difference that Medicare doesn't pay. So Medicare pays 80%, and then the United Healthcare, or whatever company it is, it doesn't matter because the plan's the same for every single company. So the plan F pays 20%. Medicare pays 80%. Plan F pays 20%. Okay, that's as simple as it is. So there's no difference between Aetna's plan F, United Healthcare's plan F, Humana's plan F, Aetna's plan F, all this different stuff, right? There's no difference between any of them. So basically what you do is you're just looking, the only difference between them is this premium. That's it. What's the premium today? What's the premium going to be in the future? So when she started her plan, it was probably in the ballpark of around $100 a month. Okay. 120 for a plan F. Now she's up to $331. Okay. Next, I'm like, all right, so plan F is a dying pool of people. You can't sell plan Fs anymore to new people that age into Medicare, right? Only people that were in Medicare before 1/1/1955, right? If they're born after 1/1/1955, meaning that people that are 67 or older basically are the only people that you could sell this product to. Is that a shrinking pool of people or a growing pool of people? It's a shrinking pool of people. So that's it, right? So that's really, really simple. Next, plan G, right? What's the difference between a plan F and a plan G? Not much, not at all. Maybe about 20, what's called the Part B deductible. That's it. So that right there, Part B deductible is $233. That's the only difference between a plan F and a plan G is they got to pay a deductible. Deductible is $233. Okay. So a plan G, right? $234. Right. If we go with Anthem's plan G, $222. Right. So she was paying right here with the plan F. With the plan F, she was paying $331, $331. We got her down to $222. $222. We saved this lady let's call it $110 a month, right? For simplicity purposes. So we saved her $1,320 in the year. She's like, people changed me before. They put me in a Medicare Advantage plan. I didn't want to be in a Medicare Advantage plan. It's not what I like. I want the freedom to go see whoever I want, right? She loves that. She just pays a premium. She's happy. So we saved this lady that much money, right? Minus the Part B premium, which is $233 for the year. If she even goes to the doctor, So if you don't go to the doctor, then she don't pay it. So for the whole year, she was paying $1,000, or she's saving like $1,300. So those are some examples of cases that I ran into, and I was like, wow, these are tremendous cases. Like I got to show people this, right? So another case that we got over here was 7706076. This guy was in this is a Medicare Advantage client once again. So this guy was in a different plan, and he was in a special needs plan, and someone had changed him to, let me see over here. So he was in like one of these. Yeah. So this one right here, there's 3 United Healthcare plans in that zip code, whatever that county might be within that zip code right there. 3 United Healthcare dual special needs plans, dual special needs plan. What is a dual special needs plan? Okay. So dual means that they have both Medicare and Medicaid. That's it. Really, really simple. Okay. Dual Medicare and Medicaid. That's it. Great. Shows you right over here. Cost sharing says it for every single one of them. Protected by Medicaid program for cost sharing. So they got to have Medicaid, full Medicaid in order to enroll in it. How do you know if they do or they don't have full Medicaid? Great question. What you have to do is you got to ask them for their Medicare or their Medicaid card, Medicare and Medicaid card. In fact, you do what's called a Medicare Medicaid verification on a carrier's portal, Unite Healthcare. Go in their portal, do it. It's under tools, and it literally says Medicare Medicaid verification. Type the information in, tells you if they qualify for it. It'll say yes or no. That's it. It's that simple. Right? The other way to do it is you can call Humana, Aetna, Unite Healthcare. It doesn't matter. You can call the companies and you can ask them, hey, is this person, are they on both Medicare and Medicaid? They don't have their Medicaid card. How do you get it? All right. You got to give them the social. That's how you get the information. So what I do with the people that are on both Medicare and Medicaid is I'm looking through all the different benefits, right? So this one comes with personal emergency response system. I don't see it here, right? It may or may not come with it. Right? So how could I find that out? Right. So what I want to do is I want to scroll all the way down the bottom just to confirm. All right. And I want to go in this thing. It's called summary of benefits. So I click it for that plan. What I do is I hit Control F and I type in personal, right? I don't see personal emergency response system, and it's abbreviated PERS. Nope. Don't see it. All right. Great. So it's not in there. Okay. So you look through it. You can look through those and see if it's in there. What's personal emergency response system? That's Life Alert. Okay. So that Life Alert right there is going to be a total cost. If they pay for Life Alert, it's like $34.90, $99, $95, whatever it is. Google it. And there's different brands, right? So some may be more, some may be less. But what I will tell you is $0 is lower than $34. So you walk into a house, and regardless of what plan you're on, it doesn't matter if they're a dual special needs plan or not, and they got the necklace around their neck, right? You can ask them if they have this personal emergency response system or if they have Life Alert. If they have Life Alert, they're paying $35 a month. Now you just saved the money there. You don't have to pay for it anymore. Good news. Right, so there you go. So it's just being creative, looking through it. There's $0 co-payments for all of these special needs plans, right? All the special needs plans. Dental, that's the next thing. This one's got $2,500 in the HMO over here that he was in. This one's got $3,000 that he was in, right? So you kind of look through it and see what it is, what's going on. This one covers preventative, comprehensive. It's got some, but it doesn't look like it covers anything beyond Medicare covered benefits, right? So that doesn't look too hot for that one, for the regional PPO. The other ones are HMOs. So you look through all this stuff, $0 copay for everything. So there's not really much you got to look at for doctors or durable medical equipment, stuff like that. Because remember, Medicaid is financial aid. It picks the cost up of whatever is left over that Medicare doesn't pay. Okay. So we scroll down, we look through it all, we see this stuff. So you're just looking for what the insurance companies have as like their selling points. So if this guy was in the PPO, right, it's really easy to change him to whichever one of these HMOs. So this HMO is $110, right, per month. And this over the counter. What does this over the counter cover? It's a great question. Let's go ahead and go back to the summary of benefits. Let's go ahead and type in OTC, which is an abbreviation for over the counter. Okay. We see that this is over the counter plus healthy food card. So it's $110 credit every month for this plan on a prepaid card to purchase approved health products or healthy groceries from network retail locations. That is awesome. That's huge. It's tremendous. So they could go to the grocery store and they get a total of $110 on the first of the month is when it loads on their card. So that is awesome. And they'll probably love you for that if they don't have it. And then you put them into it, right? So we take them from this, right? That was 65, put them in 110 or 105 and put them in the 110, whatever, right? Whatever the client wants to do. Our job is to present the information and show them exactly what they qualify for. These all have transportation. This only has 12 trips. This one, remember that guy was saying 12 one-way trips. This guy was saying he goes to a specialist every single month, right? It's like, oh, okay, well, that's 12 one-way trips. That's only 6 round trips. So that guy's probably going to need more, right? So that's interesting. Okay, great. Vision, $400 here, $400 here, $100 here. So the regional PPO, right, isn't as rich in benefits. PPOs generally are not as rich in benefits because a PPO means you can go in and out of network, and it's going to cost the insurance company a little bit more money to pay when you go out of network. So this PPO, it's going to tell you when you open up the summary of benefits again, it should tell you somewhere in here, right? Since it's regional PPO, we're going to look just to see. The plan service area covers all of Texas. Cool. All right. So it's going to cover the entire state of Texas, not the counties. So let's go ahead and let's look at the summary benefits for the other one. So it's going to tell you when you scroll down here, right? It's going to tell you where they cover. In Texas, Fort Bend and Harris County, just 2 counties. That's it. This one, entire state of Texas. That's the benefit. So if the best oncologist is not in Harris County, but is in Dallas County, they can go to the best oncologist, right? Whereas with these HMOs, oncologist is a cancer doctor, right? Or it's cardiovascular, what it might be a heart condition, might be Alzheimer's, dementia. These people want the best care. So it's what's in their best interest based on what they need. I can't go see doctors here in whatever county that is, right? I can't go see doctors in this area. What do I do? Okay, great, right? This is what we're going to be able to do. I'm be able to show you this. Well, let me show you how you can go see other doctors. Now, Mr. whoever it is, just Larry, whoever that might be. Now, Mr. Larry, you're going to be able to you'll have less benefits, but you can get the best healthcare from any doctor in the entire state of Texas, right? That this plan that they accept. But it's also a PPO, so you don't have to worry about networks and going in network or out of network. Okay, so those are some examples of cases that I see on a daily basis to see people, and I'm like, oh, okay. And then sometimes I just tell people when they have a good plan, I tell them, hey, you're in a really good plan. I wouldn't, we can put you in something else, and here's the different options, because obviously I got to tell you what the options are. That's literally my job, right? But I think what you got is pretty good, right? But I will also tell you that what you run into sometimes is with some companies is that a client, right, might be in a plan that they haven't changed because it's been around forever. And I think in about 2018, I think it might have been Aetna that came out with the first 0 premium plan. So all these plans weren't 0 premium. So sometimes clients don't even change the plans that they've had forever. But how do you know what they're in if they don't have their current health insurance card? Well, they have a Medicare.gov account. If not, right, you got to help them do this stuff. Help them go to Medicare.gov, right? You look at it, pull it up, see exactly what plan they're in. Okay, so you got that. So this right here is $94 per month. So you literally walk into a house and you're like, the husband and wife both have this plan and they haven't updated their plan. They've literally never changed. Is this plan? Let's look at this. Let's say they're adamant about staying with the PPO, right? This one's $10 a month. The other one's $94. So I save about $80 a month per person, $160 per month for each one of them. So $94 on the left, $10 on the right. Right. If they decide, like, they were just like adamant, like the reason why I didn't change is I didn't want to go to an HMO. I don't want to go to an HMO. Okay. Acupuncture, $35 copayment, $10 less. Awesome. Right. Ground ambulance goes up. You're saving $80. How often do you take an ambulance in a year? Probably not a lot. Right. So is a $15 difference right there going to make, or $25 difference, is that going to make a tremendous difference for your budget? No. Right. Probably not at all. I doubt it. Dental's the same. Right. Look at that. Dental's the same over here. Right. $2,000 towards it. $2,000 towards it. So that's pretty cool. Dental's not that, it's not different, right? It's not a large difference at all. You look at it, you go through all this stuff, right? You're looking at it. They're saving money. Don't forget, even if something's higher over here, they're still saving $80 per month per person, or $94 per month per person, right? $94 per month per person, right? Their copayment when they go to the doctor office. Do you think they go to their doctor more or they take an ambulance more? Probably say they go to their doctor more, right? I hope they're not taking ambulance that frequently. And if they are, they're going to their doctor a lot. So now it goes from $15 to $0. Copayment when they go see a specialist, $45 to $35. And instead of, if they went out of network with the PPO, it'd be a 40% co-insurance, meaning they have to pay 40% of the bill. So if the bill's $1,000, they got to pay $400. This one's a fixed cost of $65. That's pretty dang cool. Emergency care, $90, $90. Hearing services, not really too much covered here. This one's going to have a fixed copayment for the hearing services. That's pretty dang awesome, right? So I go through this, I'm scrolling through it. I look at it, outpatient surgery. Okay. The max over there is 3. So that's not really that big of a difference, right? Over the counter. This one's 25 every 3 months. This one's 25 every 3 months. Cool. No difference. That's phenomenal. So you get through and you look at the plan. This one covers 100 towards vision, 100 towards vision. You look at it, inpatient hospital stay, $325 per day for 5 days, $325 per day for 5 days. Can you tell me, you guys, even if you're green and you're new to it, give me one reason why this plan that costs $94 per month is better than that other plan. There's no reason at all. None. No reason. There's no reason for the client to stay in this plan. So you'll run into these scenarios where you're going to see it, right? They might be in the stuff and you're able to save people a lot of money. You don't know what you don't know. So get the information over and then I'll be able to review it and start looking at it. All right. So let me go ahead and open it on up to some questions here. Or if you got a case, you want to run it by us, we can go ahead and do that. So let me go ahead and hit, or you know what, I'll leave the share screen open. So that way, if you guys have questions. So go ahead and hit raise hand if you got some questions and see if there's anything. Maybe you got a case that you got. All right. Go ahead. Yep. You're good.
For this, so the finalexpensemastery.com is how I can learn this, right?
Correct. Yeah.
All right. So is that what you're going through now, or this is actual, like the actual system that you used with your clients?
This is Sunfire, which is a plan comparison tool. So this is not my website. This is a tool that's offered for free on it.
Okay. And I was going to ask what was Sunfire earlier. Okay. So it's just
Yeah.
a plan comparison tool.
Yeah.
Okay.
Yeah, exactly. Yep. And who's your upline?
Gregory Pitts.
Cool. Okay. Awesome. Yeah. So get with Gregory and connect with him and just kind of ask him all about this stuff and everything and see kind of how you would get started and stuff like that. And then, you know, we can obviously communicate, but yeah, reach out to him and see. You can go on Final Expense Services. It's the same exact thing. I built it the same way. So cool. All right. Well, just, yeah, let me know if you got any questions too. Yeah, you go on my website, like I said, and do it. So what else? Anyone else got any questions? Raise hand. Mr. Tolbert, we got asked to unmute. So I hit ask to unmute there for you. You're good. Go ahead.
Hey, how y'all doing tonight?
Good, brother. How are you?
Fantastic. Hey, I'm excited too. Quick question. The scenarios you just showed us, the comparisons and stuff, this is based on the AEP season?
No. Nope. Nothing to do with AEP. AEP means absolutely nothing to us. There's no difference at all between now and AEP. There's, if you're on my website, if you look at it, you go to the sheet that we are looking at before, pull it on up. You look at the election period cheat sheet. Gives you 2.5 pages of reasons why you could change people outside of AEP. So this has nothing to do with it. These are live, you know, right now, people that we're dealing with.
Awesome.
Yeah. So AEP, yeah, I'm not even thinking about AEP right now. Yeah, we're in July. so we got a ways away for it. But yep, everyone that we're dealing with, we are dealing with them now. Right. So we're getting these people done and kind of helping them out as best as we can. As best.
Okay. Awesome.
Yeah. Yeah. So we'll get you up to speed, man. Promise you. You're going to be crushing it. I know that you are. Carlos, you said you got a case for me.
Yeah. Hey, how's it going, Holden?
Good, buddy.
Yeah. So I kind of ran into a lady today that she's going to be 65 in September.
Sweet.
Yeah. So, but she doesn't have a red, white, and blue card. She doesn't know how to apply for Social Security. She wants assistance with that. And obviously I want to help her so I can, you know, make sure she gets some health insurance as quickly as possible. Yeah. So how would I go about, you know, helping her with that?
Yeah, definitely. So that's definitely something that's important. Right. So back to my website over here, we're going to go to the intro to Medicare, right? You're going to go ahead and, you know, watch something like the Medicare Basics 101. And I think in that one, it has it. I'm going to pull up the PowerPoint and show you in there. But yeah, so the answer to the question is definitely inside the training, but you're out in the field, right? You're sitting down with the client. You may not know the answer. So we want to get the answer, you know, quickly. So that's obviously, it's like, all right, well, I want to, you know, kind of, can you explain to me exactly how we do it? Like, how does it work? So what I do is I go, I'll kind of show you exactly how it works. So let me see here. Y'all should be able to see my screen. So the video, like I said, is Medicare Basics 101. So what you want to do is this PowerPoint's in there. So just go ahead and read that. 1 second. Let me just go ahead and minimize this. It's on the wrong screen. So let me flip this over here. Let's see if it'll do it now. Nope. Okay. I should be able to flip the screen some way, somehow. but it doesn't matter anyways. So y'all can see it. So right over here, we have this. When and how can clients enroll in this? Right. So here you go. So just write down this information. And that's exactly, spot presenter. There we go. All right. So when and how can clients enroll? So that's what you got to know right there. So that's everything that you need to know, which is really important. And you look at it. So clients have 7 months to enroll in a Medicare Advantage plan with what's called an IEP. So it's initial election period. This is 3 months before their birth month. It includes their birth month and then 3 months after their birth month. So it's 7 months total for a Medicare Advantage plan. Okay. That's their IEP, first time that they can enroll. If they're already collecting Social Security, and they have been for 4+ months before they turn 65, they're automatically enrolled in it. Awesome. Sweet. If they are not collecting Social Security, you can enroll by online at ssa.gov/Medicare. Call Social Security, right? They have to call and set up Social Security anyway, so you do that. Or you can go down to your Social Security office and get that set up.
Okay, perfect. That pretty much answers my question. One more thing is this person has only been it's an immigrant, okay? So she's only been here for about 8 years. So I know that has something to do with their SSI. They can still get their red, white, and blue card, right? I mean,
So
that's
the rule is that they have to have worked. There's no premium for Part A if they work 10 years or 40 quarters. Okay. And then this is Part B. There's going to be a premium for them of $170.10. So the rule is 10 years or 40 quarters that they've worked, because you got to pay in the system in order to get the system. So that's really important for you to understand. So she's really got to go ahead and like, this is what she's got to do, right? She's got to talk to Social Security. She's got to talk to them and kind of figure it out. Cause I don't want to guess and tell you something that's wrong, right? Where this client may have some other information that can put a curveball in it. Like that, right? So if it's 8 years, she might not qualify for it. So I definitely want you to go ahead and do that. And you can help her, because for like in general, usually, I mean, Mike and I were talking about this, like, we don't want to do everything for the clients. I'm not taking them to the Medicaid office, but for you, since you're new, you're green, it's easier for you to go ahead and get that learning experience by helping a client do this stuff, right? So a lot of people, they need help. So yeah, so you can walk them through this.
got it.
And for you, the red, white, and blue card, once she does, or just in general, let's just say generally speaking, for people, as soon as they get that red, white, and blue card, okay, let's say, so for example, this example, it was starting in October, he said. Okay, so right now we're in July. So since we can go as far as 3 months out from right now in July, we can enroll people for an effective date, starting date of 3 months after July, August, September, October. Perfect. So she fits in the window right now. So she should have her Medicare card now in this month of July. If she doesn't, right? If she doesn't have that red, white, and blue card, then we're going to go ahead and see if we can help her get it out. And as soon as she gets that red, white, and blue card, then what we're going to do is we're going to go ahead and help her enroll into a plan, explain to her the differences between a Med Sup and a Medicare Advantage plan. Yeah. So Tavia, I would say for you, I definitely go into the training itself. And like that'll teach you everything that you need to know too. Because I know it's like, for you, it's brand new, right? So you're a little bit green with it. So it's okay. Just you'll go in the training, you'll learn everything that you need to know in there. So you'll see that. You'll see like what the card looks like and all that stuff. Cool. So we got that one. Let me X out of this. It's okay. You are good. I promise you. So let me X out of the PowerPoint. Who else has some questions for us? Mr. Mike Ramos, I'm pretty sure he's on here. Yeah. Mike, you want to add some stuff? Oh, Vanessa. Yeah, sure. Go ahead, Vanessa. Let me go ahead and ask to unmute you there.
Okay, great. I have a couple questions.
Yeah.
I do have a client who has a SUP. She has a Plan F. She says she's had it for a very long time. I think she may pay even less than $200 for it. She now wants silver sneakers, which I know is in a lot of the MAPD plans. And does Med Sups offer silver sneakers? You know, that fitness benefit, or because you know, I know there's that. Yeah, okay, so I know there's that thing that once they leave, like if she leaves Plan F, she can't go back. Correct?
She can go back to
she
Plan
can.
F. Yeah. So
okay.
So yeah. So people say that all the time, like, oh
Yeah.
well, if she's not in a plan F, so if she leaves her plan F, she can never get it back. Well, maybe, right?
Okay.
It depends on her health because Medicare supplements, those are underwritten products. So it
Mhm.
could or it could not. I can't tell you.
Right.
Because I don't know her health, obviously. But
Okay.
yeah, so it definitely depends for us over here if we're going to be able to do that. So it could be subjective to that specific client. Like if her health is really bad and she's paying $200 a month and she's got a plan F, it's like keep it. But
Yeah.
if her health is really good and she can pass underwriting elsewhere, then yeah, by all means, let's change it because a plan F is cheap now for $200, right? But
Mhm.
it's a dying pool of people where you can literally not add any new blood at all. So it's
Okay,
like,
gotcha.
yeah, we definitely want to do that for sure. Definitely want to do that. Yeah.
Okay, the second question is another client. She's aging into Medicare, for the initial election period in September. And she's contacted me that she's just received another document. She took pictures, scanned it to me, and it's basically like the application for LIS for the subsidy.
Okay.
So my question is, should she go ahead? Well, she's filling that out now. Should we let her submit that first and then sign up for an MAPD and find out,
No.
or does that not matter?
No, yeah. So
Okay.
with her, so if someone's new to Medicare like that, well, first and foremost, you want to get them enrolled like ASAP because people are going to hound her down. They're going to call her and they're going to pretend like they're, from Medicare, right? So
Right.
some of the call centers are really bad. So it's like, hey, Medicare never calls you, Miss Mary. Okay. Only I'm going to call you. So Medicare ain't never going to call you. It's just me and you. So yeah. So when you look at it, you're going to go ahead and we're going to try and get her in a plan. And then you and I, obviously we'll look at it, which is great.
Okay.
So since she's got her red, white, and blue card already, we can start looking at it and doing, hey, what's better for you, Medicare Advantage or Medicare Supplement? If she's qualifying for LIS and her income's that low, I would assume that she doesn't want to pay $150 a month for health insurance. Plus,
Correct.
whatever other premiums that she might have. She wants dental, vision, hearing, like you were saying, right? A Medicare supplement plan does not cover anything beyond original Medicare. So that means it doesn't cover dental, vision, hearing. It doesn't cover, like you said, silver sneakers, which is a free gym membership. It doesn't cover personal emergency response system. It doesn't cover transportation. So it doesn't cover that stuff. Okay. So that's great information. So we just got to provide that to her and we do like a little presentation. And then of course we make sure that she also has a hospital indemnity plan, right? Because with a Medicare Advantage plan, there's gaps in it. So I'm going to show you next week, actually. We're going to do it live. Right, we're going to do it live. So next week in Dallas, me, you, Conrad, we got a couple other people come in the office. We're going to do it live. So we're going to do that one.
Fantastic.
So we're saving that case. Is that okay with you?
No, that's perfect.
Okay.
And I'll let her know. She's currently one of my clients, my final expense clients. So, okay. Thank you so much, Holden.
Yeah.
So we'll do it next week.
And so next week is the 3rd. I'm looking at my calendar. So it works out good because she can't even start her effective date till September 1st anyways. So it's like, yeah, we got plenty of time. You know what I mean? Okay. So since she was born, so it's whatever her birth month is, forget her birthday, whatever her birth month is, it'll start the 1st. So she's got that card. So that'll be like a really great example for us on Wednesday. So I appreciate you finding that for us.
Okay, great. Thank you.
Cool. Of course. I appreciate you. What else we got? Anyone else? Yeah. I appreciate everyone for joining, just going over this stuff with us. Let me see if there's any other questions here. Cool. Yep. So how you get paid. Yeah, that's in there as well. Yeah. So yeah, going through the training, that's going to give you a lot of insight too. But don't be overwhelmed. So here's a really important thing. So if you're really green, you're really new to the insurance industry, just in general. Oh, Vanessa, I'm sorry. Did you have another question? My bad. I muted you on accident. If you got another question, you can unmute. Sorry about that.
Yeah, I forgot about these two. These are real important.
Yeah.
I have 2 cases. They are currently enrolled on, they're dual eligible. So they've got some DSNP programs. So they can change quarterly, correct?
Yeah. Okay. Yeah. Not only can they change quarterly, right? But if we looked at that sheet right over here, we go to Medicare Parts and Programs section on my website. You can't see my screen, so you're not seeing where I'm going. Let me do that. You go over here, you got the election period cheat sheet. There's a ton of different reasons why they're going to actually be able to change outside of using this SEP dual/LAS maintaining, right? So there's going to be plenty of other reasons as to why they can change. Maybe they had a change in status and they just got it or they lost it, whatever it is. right? There's going to be a 5-star plan if there's a natural disaster and you got a 5-star in the area, which we do here in Dallas, right? This Dallas Fort Worth area. So there's actually a ton of reasons as to why, just outside of once per quarter, because they're on Medicare and Medicaid, or Medicare and LIS, which is the low income subsidy, which you just mentioned too. So
Okay.
yes, yep.
Okay,
And
thank you.
it says it's somewhere over here too. It tells you that they could change once per quarter. Cool. Let me unshare my screen here. Stop share. I think that was it with that question. Yeah. Okay, cool. So she muted. Or I'm sorry, Vanessa, did you have another question?
No, I'm fine.
Cool. All right. Well, I appreciate you. Thank you. Great questions. I think a lot of times, I think about 80% of people are afraid to ask questions. So the fact that people are asking questions, what that just shows me right there is that probably answers a question that maybe 80% of you might have had, but maybe y'all are a little scared to ask questions. That's okay. So Jeff, I asked to unmute there, Mr. Poach. So if you could do that. Yes. All right, go ahead, buddy.
Hey, Holden, what's up? I don't know if this is a question for this call, but I ran into a guy that has TRICARE for Life today, which
Yes.
I think is the best military full coverage, correct?
Absolutely.
So he, and then I read a separate post on social media that says we can add like some different silver sneakers and some different things to those plans, correct?
Yep. Yeah. So when people have TRICARE, generally the issue that they run into, since they don't pay anything, okay, and TRICARE for Life, just so you know, it's for people that are vets. You can mess up their current TRICARE benefits by enrolling them in a Medicare Advantage plan, okay? Because the billing is the worst. So it's just, that's what the issue always is. And then what happens is people complain and they cancel. So just be careful with it. So I don't always recommend doing it. I have to explain every single person, hey, this is what's going to happen. You're probably going to end up having co-payments, whereas right now you don't. And they're like, yeah, I don't want that. Okay. Right. So most of the time I say, just, leave it be. But if someone's saying, hey, like, I'm in great health, I don't even go to the doctor, but this doesn't cover the dental. Like, can I get a Medicare Advantage plan that has dental, right? Can I get it and use it for dental and then not have it 6 months or 12 months later? It's like, yeah, okay. But you don't have to keep it forever if you don't want to, if you got TRICARE. So TRICARE is amazing coverage. It's great coverage. We don't replace TRICARE, but you can add stuff to it, right? So to answer the question, I'm not really selling people that have TRICARE anything separate. If you guys don't know what TRICARE is, just go ahead and Google it, and you'll be able to kind of read up on that and figure out exactly what it is. It's a great question.
Good deal. Thanks, man.
Yes, sir. I appreciate you. Thank you for the question. Mr. Scott Bryan, you are asked to unmute. Go ahead, my man.
Hey, like I said, this also may not pertain to this call, but I had a customer who originally had original Medicare, and he was retiring. And so he went to Social Security office, and now he's got the first official letter, this is how much is going to come out of your Social Security. And it definitely was, the amount is definitely below the threshold so he could have LIS. Is there a certain waiting period? Can he go and apply for LIS now if he's just finished working?
Yeah. So whenever the Medicare starts. So, all right. So let's go through it real quick. Part D, LIS chart, LIS/extra help application. Go ahead and click it. Apply online for extra help. Just so you guys know, if you don't know what extra help is, like I said, go through the training and just read this stuff on here. Okay. So you can read through it and go ahead and hit apply now. And then they ask some questions, right? Read through over here, go next. And then it asks these questions over here, right? Do you or your spouse have Medicare? So do you currently have it? So that's pretty important. Only individuals who are eligible for or have Medicare may use this application. If you or your spouse, if married and living together, you may be eligible for extra help to pay for your monthly premiums, annual deductibles, and co-payments related to new prescription drug program. So he's got to be on it in order to apply for it. Okay. So just wait a little bit or whenever. When does he start Medicare?
Oh, he starts 8/1.
Oh, okay. Yeah. I mean, he's right here. Boom, done. Yeah.
Okay.
So just like 8/1, it's like applications in.
Yeah, because it asked a question that I've never had to answer is, did you work in 20?
2021 and 2020. Yep. Yeah. So because it's based on income, remember, so it's based on income, right? So because it's based on income, what happens is the client, right? If his income is above the threshold, then he's not going to qualify for it. But that doesn't matter for him because he just retired. So yes, he worked in those years, but he doesn't have the income. So if he meets the threshold, meets the requirements, then he's good to go, basically. So you already know what the numbers are for that. So I don't got to explain the numbers for that one for you. But what you want to do is go ahead and put that app on Inform and, see if the state approves it. Well, federal government is LIS. The state is Medicare Savings Program, which pays for that Part B premium. So that's what we want to be able to do and help him out with that. But yeah, he's got to have it first in order to qualify for it.
Thank you, sir.
Yes, sir. Appreciate you. Great question. Great question. Yeah. Oh, Jeff, hey, you're unmuted again. Jeff, you got another question for me? Mr. Poach.
Oh no, sorry, man. I didn't know I was on
you're
mute.
good.
Sorry about that.
You're good, brother. Let's see. Those are phenomenal questions. Those are great questions. Real live questions that you got. So cool. Anybody else? If not, I appreciate everyone joining and y'all have a wonderful evening. Let me just check, give you all another second. Good to go. Cool. Well, I appreciate everyone joining this call this evening. Thanks for an hour of your time. Have a great evening. I will see you guys on our Monday night training call, which is going to be a phenomenal one for final expense. Don't miss it. And I'll see you next week for Medicare Wednesdays.